We turn now to our field reporter, Laura Windsor. She gets some information on pediatric hemophilia.
Hemophilia in children is an inherited disease that infringes on the life of the child and also impacts the lives of the family as well. Dr. Diane Nugent of Children's Hospital of Orange County explains how this condition is managed.
There are many challenges for not only a child with hemophilia, but for the family with hemophilia. All of us have our children come into this world and we have all sorts of hopes for them. And for a family who has never had any hemophilia in their family, it is a hereditary disease. So some families know that they may have a child with hemophilia, but for a family where it's the very first time that they're finding out that they have a child that has a bleeding disorder, I think that the most important thing for us to do is help the parent understand that they can have a normal child and that that child can attain the dreams and hopes that they had. It's important for them to become part of the therapy and to help us to treat that child optimally. There's been some terrific work done in Scandinavia and in our country, in Colorado, with Dr. Manko Johnson, that's shown if we treat prophylactically, in other words, if we replace the factor that's missing and not wait until a child bleeds, that they grow up to have normal joints. And if you can get to adulthood when we all slow down and we're not so active, usually then that means much less disease as an adult. And the challenges have been for the families is that this is very expensive therapy. And so over the last decade, we've tried hard to get pure factor, to have no contamination. You know, our wonderful last generation of hemophilia patients was devastated by HIV. And we never want that to happen again. So we try as hard as possible to assure that the factor is absolutely pure and that there's not going to be any infection. But having then accepted that it's a safe product, what we're trying to do is have the kids replace themselves to a normal level so they can live a normal life. The National Hemophilia Foundation is a long-standing organization formed and supported by families and community members. There's a lot of involvement with physicians and local foundations of patients with hemophilia and healthcare providers that care for patients. It's a wonderful website, especially for our new families to go and find out what's going on. I was previously part of the MASAC, which is the Medical and Scientific Advisory Board. This is a board that is composed of physicians and nurses and a large variety of people that write the guidelines, the benchmarks for optimal care for our patients. So our patients can go onto that website and find out where the centers are, what the optimal treatment is, and they're able to chat with other families that have kids with any kind of bleeding disorder. So it's very, very useful. It's a wonderful organization.
Although there is no cure for hemophilia, there are options available to treat this condition and help children live better and more productive lives through optimal management. I'm Laura Windsor for the American Health Journal.